Hi, welcome to Canine Wellness Online. This is week 2 of your TPLO recovery. And today what we're going to discuss is some of the warning signs, a tip for you for week 2, and an exercise for you to do at home. At this point, your dog should be at the very least toe touching. And what that means is just tapping the foot on the ground. You probably won't have the foot on the ground all the time. You may notice when you're walking your dog for the 5-minute walk that your dog will be actually putting a little bit of weight on it. The surgeon will tell you that you're still to go out back to do bathroom duties. What I have found is, and I tell all my clients, is take your dog out front and do 5 minutes to somebody's house, like, you know, I don't know, 10 houses down and 10 houses back. That could be 10 minutes. If you're really worried or your dog is a really serious puller, and you want to take them out front, I would advise you to get some sort of no-pull harness or a snoot loop, as they call them, something so they can't pull, because you definitely don't want your dog pulling when when they're at week 2 following surgery. As a warning sign, if by week 2 your dog has increased inflammation and again any kind of discharge that doesn't look normal coming out of the surgery site, definitely a time to call your vet. This week, it's a great idea if you play some safe games at home to keep your dog busy. So in my other video up here, I talked about playing Find It with your dog. And Find It is a great game to play because your dog is not doing any explosive movements, and when they're looking for the treat in a contained area, they will use the leg a little more because they're not thinking about it. So, exercises. So at week 2, you can start walking your dog 7 to 10 minutes. You may want to start this week with 7 minutes and then go up to 10 minutes with a short leash and slowly. Now, if your dog seems sore, I would recommend backing up to the previous amount of time that you were going and waiting a day or 2. The problem is with soreness is we don't know if it's muscle soreness or if it's joint related. So what I often tell my clients is if they seem sore for 24 hours and it goes away, then I would not be worried. However, if it lasts more than a day, then I'd be concerned and want to back off. The second exercise I'm going to show you is called weight shifting. Weight shifting is just as it sounds. So essentially you have your dog standing. So in this case, let's say the surgery leg is the right leg. So what you're going to do is when your dog is standing, and again, I would put my hand underneath, I'm not lifting, but just if your dog wants to fall over, then you're there to stop that from happening. And all you're going to do is push towards that surgery leg, and then you'll feel hopefully a little bit of resistance. You may not feel much resistance at this point, but you'll feel a little resistance and then let go. And then push towards that side. And effectively what you're looking for is these toes should start spreading apart. The more apart the toes are, tells you the more they're weight bearing. So hopefully you enjoyed this video. Please like and subscribe and leave me a comment in the comment sections. Thanks a lot. Have a good day.